Hello everyone, this is Dr. Rajeshwar Gudadhe from Dr. Bhatia Medical Institute, Nagpur, and this is my proud privilege to inform you that our foundation course student, Dr. Dhvani Raithatha, has secured a rank 17 in November 2017 PGI Chandigarh exam. Many congratulations, Dr. Dhvani.
Thank you so much, sir.
And how is the feeling now?
The feeling hasn't sunk in.
Okay, that's really good. So did you recheck the result?
Multiple times, yes.
So that's really good. As we all know, that many students from our region they aim for PGI. Basically, we do prepare for our NEET, or previous to that, we used to prepare for All India and Maharashtra entrance exam. That was the trend over here. And some of the students like Dr. Abhinav Jogani, Achintya Singh, who has secured a rank 4 in AIMS, and now Dr. Dhani has secured rank 17. They have laid this benchmark. You must have done something different from the other students. Throw some light on this.
Okay, so no, I did not do anything different from anybody. After the NEET results were out last year, I binge watched all toppers' interviews. I read their interviews, I watched their interviews, and I picked out points which I knew I could implement when I made my study plan.
Okay.
And I just followed there.
Right. As we all know that PGI is a little bit different exam. I would not say it's a difficult exam, because if we trace the previous year results, the students who have topped in AIMS or in NEET, the same students have topped in PGI also, or at least they are in the toppers list as well. So it is a different exam, not a difficult exam. So like they are having 250 questions to be solved in 3 hours.
Yes.
So unlike AIMS, 200 questions to be solved in 3 hours, it's 250.
Yes.
And it's multiple options are correct, right?
Yes.
And every question has 5 options.
Yes.
So for 250 questions, guys, it's 1250 options. And what we will call as a safe score, or maybe this much of the options to be marked and this much has to be left. Is there any calculation like that?
Yeah, so I know a lot of people tell you to go high on marking, or some will ask you to play safe. So what I did was, I gave a lot of PGI tests. I saw their recent papers, and then I realized that no matter how many options I was marking, I always got around 450 to 460 options correct. So if I went high, I got more number of negatives. If I went low, the negatives reduced. So in my final exam, I marked around 475 options.
Okay. This is very important point. She just said that she marked around 475 options. And if she goes on the higher side, the negatives will increase. And is there any specific strategy for the subjects also? For PGI, are there any subjects which are more beneficial, more useful?
Yes. So the theory part essentially is the same for all exams, but PGI has this trend of making options from particular topics more commonly. So like you'll almost always find H. pylori, you'll almost always find a question on neuroblastoma. So they have a few hot topics which they tend to make their options on, whether right or wrong. You need to do those topics very well, and it pays off, giving those topics extra time.
So you need to say that this last few years questions, all the topics will get repeated.
Topics will get repeated, yes, definitely.
Not the option, but you need to focus on the last maybe 5 years or 7 years.
I actually did only last 4 papers, so that's twice a year.
Okay.
So I did
last 2 years papers
yes.
only. I mean, this is incredible. This was her first attempt. She did just last 2 years papers, that is 4 papers only, and she managed to score rank 17, and that's really awesome. And what all subjects, like you told that H. pylori was an important thing. You will see the question from H. pylori in one or the other papers of PGI.
Yes.
So I also heard that this medicine, surgery, biochemistry,
yes.
and to some extent pharma and patho, they are, and obsgyny as well.
Yes.
So these are 6 to 7 subjects.
Yeah, very important.
They have high weightage in
yes.
PGI entrance exam. Okay. Any message for the juniors? Like I already said that many of our juniors or many of our students in this region particularly, they directly target for NEET or maybe All India and this Maharashtra State. JIPMER, NIMHANS, PGI and AIMS are the central institutes, and we have students who have really scored well. Any message to your juniors about these exams?
Yeah, so I know that we complete our internship in March, so we're not eligible in our first attempt for these central institutes. This is one of the most important reasons that we don't aim for it. But for all those people who are taking a year off, or even like you will have these exams again in May and we are eligible, so just don't stop working. It's the same notes, you have to revise again, give tests, don't be afraid of giving tests, because they will make you feel like the way you will in the real exam. So even when you're taking practice tests, have that feeling that this test is going to give me a rank. Only then will you be able to mark your options wisely in your practice as well as the final exam.
And this is another important point. Like she said that giving tests is really important. You need to mark out an area where you are failing at. I mean, which the commonly repeated mistakes. You need to mark that and you need to work on that. For that, you need to give mock tests, right? What about this foundation course? Did it help? What was the role of basically DBMCI in your preparation?
Coaching gives you a direction, because the course is very vast. The entire MBBS course is very vast, and not all of it is as important for your entrance exam. So the coaching institutes helped us build our concepts, and once your concepts are clear, you can go beyond that through your own efforts and through the effort. I mean, it's not that hard afterwards once the concepts are clear.
Right. We will give you the guidance and the extracted material of all the subjects. You need to put on your efforts. Any specific subject you would like to mention about, any specific faculty or any specific notes?
There are multiple teachers that I really enjoyed their classes. So among, if I were to name a few, I'd say Dr. Dhvani sir, Dr. Tamim sir, Dr. Aroda, Dr. Manish Soni, Dr. Rajat Jain. I mean, yeah, I could keep
There's
naming.
quite a bunch of faculties, and really very glad to hear that. And we have this example that if you have the courage, or you have this thinking or positive thinking to go for the entrance exam, you definitely can do it. I mean, we have this live example. It was the first attempt and she knocked it. What about the NEET now? You're going for the entrance exam? I mean, you will get this branch of your choice. College is already there.
Let's see. Yeah, I hope I can pull myself until NEET to give it.
Right. So all the very best, Dr. Dhvani, and we will look forward what you take in PGI Chandigarh and what happens in NEET as well.
Thank you so much, sir.
Right. Thank you all. Yeah.